and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes, good evening. Well, let me say happy carnival. I know there must be a big show on in St. Vincent and the Grenadines. I think Kez the band will be playing this evening. But you know, the show must go on. I want to tell you, I'm not in St. Vincent. Imagine I left St. Vincent on Tuesday to come to a conference, an important conference in Dominica. That's where I am. I am in the Commonwealth of Dominica. What a wonderful nature island. Place that I love. Wonderful place. But this evening, as I said, the show must go on. We'll get a little bit of background noise. But I want to talk to you about the kidneys. And I think it's important to know that each of us have two kidneys. Two kidneys. One on the right hand side and one on the left hand side. It's inside your belly to the back of your belly. As a matter of fact, there is an area just below the back of your ribs where your ribs meet the spine in your back. Just coming across on the right hand side and the left hand side is your kidneys. Now, your kidneys, believe it or not, about as big as an open fist. Your kidneys, each of them, about as big as your open fist. Now, let me tell you, your kidneys play a vital function in your body. You know, in your car, gasoline goes to your engine. You need a filter. Oil goes to your engine to help cool it down. You need an oil filter. If you don't have these filters, you're in trouble. In your carburetor, you need an air filter sometimes. And whether it's an oil filter, air filter, fuel filter, these filters help to make sure that only the purest amount of substance is getting to that part of your car. Well, your kidneys does a similar job. They essentially help to make sure that your blood is filtered, but they do much more than that. Your kidneys are also involved in helping your red blood cells to be produced. Yeah. Your kidneys produce substances that help your red blood cells produce. Your kidneys do a host of things, but this program is not about the function of your kidneys. It's about what happens when your kidneys are not functioning. Let me tell you off the bat, there is a condition called chronic renal failure. There's something called sudden renal failure. We don't talk about that too much. Sudden renal failure, acute renal failure. I'm talking about chronic renal failure. And the most common cause of chronic renal failure, guess what it is? Diabetes, sugar. Yes. And guess what the second most important cause of renal failure, chronic renal failure, guess what that is? High blood pressure. I'm going to put it to you, and diabetes and high blood pressure account for some 75% of the causes of the people who have chronic renal failure. So if you have diabetes for a long time and it has not been treated properly, you ain't bothering with it, you ain't dealing with it, it could eventually lead to all sorts of other problems. One of those problems is chronic renal failure. And if you have high blood pressure and you ain't studying that blood pressure, you ain't bothering with that. Yeah, it gives you some headache and gives you some other problems, but you don't want to see a doctor. And you have high blood pressure for 10, 15 years straight, you're not doing anything about it, well, it's going to lead to chronic renal failure. What about those persons who have both diabetes, sugar, as well as pressure, high blood pressure? The double whammy of sugar and pressure for sure is going to lead to chronic renal failure. So, the greatest cause of kidney failure is diabetes. High blood pressure is the second leading cause, and both conditions can damage the kidneys over time, leading to chronic kidney disease, also known as renal failure. Now, diabetes, let me talk about specifically. High blood sugar from diabetes can damage the very tiny blood vessels inside the kidneys. I'm talking about the very tiny blood vessels you can't see, the very small one. And these tiny blood vessels are what really are attached to the filters of your kidneys. So when they're blocked, when they're damaged, the whole kidney filtration system fails. The kidney system, the filtration system is called glomeruli. I don't want to use those words. Glomeruli. And I met somebody on the road and they told me, Doc, when you mention this name, you must spell it out. So let me spell it out. Glomeruli. 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 These are the tiny filtering systems, the filters, tiny filters inside your kidneys, and the blood vessels that come close to them. If those blood vessels, tiny blood vessels, are getting blocked, those glomeruli filters get blocked too, get damaged too. And over time, this damage can lead to chronic kidney disease and kidney failure. Both type 1 diabetes and type 2 diabetes, which is the common one, contribute to renal failure. Now, high blood pressure can damage the blood vessels of the kidneys too. They can also damage the glomeruli. And this damage can also lead to chronic renal failure and kidney failure. So I can't emphasize more. If you are a person who's diagnosed with both sugar and pressure, diabetes and high blood pressure, you have what's called a double whammy. A double whammy. And you should be very, 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 very careful. How much varies can I say? Very, 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 very careful. Now, there are other causes, and let me just list a few of them, right? So while diabetes and high blood pressure are the most common causes of renal failure, other conditions can also lead to renal failure. Let me give you a few. There is an inflammation of the same glomeruli called glomerulonephritis. Glomerulonephritis. This is not a very common disease like diabetes, hypertension. Boy, you don't want this. You don't want this. And it's an inflammation of the kidney filtering unit. There's another condition called polycystic kidney disease. Polycystic, polycystic kidney disease. This is where your kidneys are not solid. They got a whole set of cysts holes in them. These bulgy, bubbly, like you know, if you take a balloon and you make a bobby out and you make a bobby out to rub on your hand and make a sound. Imagine multiple bobbies inside your kidneys. That's polycystic kidney. It's a genetic disease and it runs in certain families. It's an inherited condition, and it will be passed on from one family member to another, right? And it causes these cysts to form inside the kidney. You don't want that. You don't want that. And obviously, unfortunately, you don't know if the person you are mating with, of your father and mother, have the genes for that. But if you have polycystic kidney disease, it's not good. You know. Then what about urinary tract problems? When I talk about urinary tract problem, I'm not talking about just urinary tract infection. Suppose the urinary tract starts with the bladder, right? Sorry, with the kidneys. Then the tubes come from the kidneys to the bladder. Sorry, I should have said that first. And from the bladder, it goes out through another tube to the outside. In the case of a man, just below the bladder, there's a prostate. Well, guess what? If the prostate starts to have disease, like becoming large, it's upsetting the flow of urine from the kidneys through the tube leading down to the bladder, from the bladder out the penis to the outside. In other words, because the prostate is enlarged, it could squeeze those tubes and block them. What about kidney stones? Kidney stones also cause a problem. I'm gonna have to just wouldn't believe what's happened. I have a power situation. Come on.
I'm hearing you. I'm here.
I
I'm
wonder
listening.
if we could just take a break for a second. Can we take a break?
Yes, we can do
Take a
that.
break. Let me go and plug in my laptop.
Oh, okay. All right.
Your health matters. How much do you know about what makes up a healthy lifestyle? Your health matters. How do you define good nutrition?
Join Dr. Gerald Thompson, physician, specialist, and notable environmental conservationist every Wednesday, 8 to 9 p.m. here on WeFM 99.9. Your health matters. Ask Dr. Thompson any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here on WeFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Your health matters.
How much do you know about what makes up a healthy lifestyle?
Your health matters.
How do you define good nutrition?
Join Dr. Gerald Thompson, physician, specialist, and notable environmental conservationist every Wednesday, 8 to 9 p.m. here on WeFM 99.9. Your health matters. Ask Dr. Thompson any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here on WeFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
All right, Doc, we're back with you now.
Am I with you now?
Yes, you're back and you're live.
Come on.
Yes, you're back and you're live. Are you able to hear me? Uh,
Am I
uh,
with you?
yes, you are. Can you hear me? Okay, we seem to be
Oh,
having some.
oh God.
All right, just need to.
Yes,
All right, so
sorry
you
about
can hear
that.
me now, right?
I can
Okay,
hear you.
wonderful. Right, so we're back.
Oh gosh. Yeah, but I tell you, these technology from afar. Listeners, I just apologize. I thought my laptop was charged, and I don't know where the drainage went, but it just went down very fast. And before I could plug it in, it went off. Anyway, I was telling you that about inflammation of the kidneys could cause renal failure. I said cyst, polycystic kidney disease. I should even mention those things. I was saying if there's any kind of obstruction of the tract of the kidneys, such as from an enlarged prostate, a kidney stone, or if there's a cancer, let's say somewhere in the bladder blocking the urine from flowing, and certain infections. You know, some people get some bad infections, end up in the intensive care unit. But when they get an infection, they get into a kind of a shock, a septic shock. One of the big casualties of that is the kidneys, you know? And then I want to mention that there are a number of medications, ordinary drugs. I'm not talking about drugs for people who are drug addicts. I'm talking about medications that a doctor gives you that could sometimes damage your kidneys, right? And this is very true if these medications are taken in excess and over a long period of time. So, kidney failure can be caused by many things, but I want to emphasize the point that diabetes and high blood pressure are the big boys for kidney failure. They are the ones, they're the big culprits. And if you have those, boy, if you could control that, you're okay. Because having polycystic kidney disease, you're gonna have the genetics for that. Some family members will pass it on to you. A bad infection, you gotta be so unlucky to get a bad infection. Glomerulonephritis and all these other things. These things are not nice. So we have just gone through some of the causes of kidney failure, and chronic kidney failure is something that you should know about, because a stitch in time saves nine. A stitch in time saves nine. Chronic renal failure is something that takes place over a period of time. And lots of studies have been done on that. So, chronic kidney failure, also called chronic kidney disease, involves a gradual loss of kidney function. This chronic issue is something that takes place over a period of time. Your kidney is supposed to filter the waste and also get rid of any excess fluid from your blood so that you could pee it out, you could urinate it out. You need to remove these things. And in advanced kidney disease, renal failure, you are unable to filter the waste. You are unable to get rid of excess water in your blood. So you can imagine what happens. You start to swell. The waste products that are in your blood that have been produced every day builds up and cause all sort of problems. You start getting all sorts of mineral problems. We call electrolyte. And all these things get distorted. It's not nice. It's not nice at all. Now, come on. Hello? You saying
I'm
something?
hearing you. You're like, no, no,
Yeah.
no, no, no.
Now, in the early stages of kidney disease, you might have few signs or symptoms at all. You you might not even realize you have kidney disease or you're going towards full-fledged kidney failure. You know, treatment for chronic kidney disease focuses on slowing down the progression of this chronic disease, because day by day you are losing a little bit more of your kidney function. Your kidneys is getting worse day by day, week by week, year by year. Yes, year by year. This is something that takes place over a period of time. And so chronic kidney disease can progress from being mild to moderate to being severe, end stage kidney disease, which is going to be fatal unless you end up start doing dialysis or you have a kidney transplant. Now, you have to know this. Everybody should know this. The signs and symptoms of chronic failure, when it's really getting bad, these signs and symptoms, I told you, develops over a period of time. Some symptoms you won't have if your renal failure, the kidney disease is mild. It might even happen if it's moderate. It might only happen if it's severe. But let me go through a few of these. Nausea, feeling nauseous, while it could even lead to actual vomiting. Because of most chronic diseases make you lose your appetite, loss of appetite. Most chronic illnesses make you feel fatigue and weak. Fatigue and weakness. Most chronic illnesses like these would give you sleep disorder. If you feel fatigue and weak and loss of appetite, nausea and vomit, you can have problems sleeping. Sleep problem. You will also notice you urinate less. Most of us will urinate about 2-3 times a day. You're urinating, yes, less, because your kidneys cannot squeeze out the water, the excess water from your body. Because the toxins, the waste products are building up in your blood, this also starts to affect your brain. You start getting a little confused. Your mental sharpness ain't there. Matter of fact, you may even start to have muscle cramps as the waste start to build up and as the minerals start giving problem. You start having, as I say, as you can't get rid of the fluid, swelling of your feet and your ankles. Your skin starts getting dry and itchy. You start to scratch. And guess what? Your pressure, which may have even caused the renal failure, starts to go up even more. High blood pressure and renal failure go hand in hand. High blood pressure can cause renal failure. Renal failure will cause even worse high blood pressure. And then, as fluid, as I said, builds up in your legs and your ankles, guess what? It all starts to build up in your chest. You start feeling short of breath because fluids start to build up inside your chest around your lungs, preventing your lungs from expanding. You could even get chest pain, and all those sort of things start affecting your heart. So the signs and symptoms of kidney failure are often non-specific. Other things can cause them. But putting all this together, the doctor who is treating you will have an idea this may be a kidney problem also. When to see a doctor, make an appointment with a doctor if you have any of these signs. Hopefully you'll find out that it's some other reason. Some other reason. It's not renal failure. That's great, wonderful. But if it is, you might have picked it up earlier than you would have otherwise picked it up if you did not go to the doctor. Because they will know what tests to do and so and help pick this stuff up. You know, they can't just look at you and say you're all right. They have to sometimes take blood tests. You got to do a number of other things in the examination. So if you have a medical condition that increases your risk of kidney disease or renal failure, you should be seeing your doctor more often, right? Now, chronic kidney disease can affect, let me put it that way. Chronic kidney disease can affect almost every part of your body and can cause a whole set of complications. Remember I told you about your kidneys help to filter waste and get rid of excess water. So if you can't get rid of the excess water, what do you think happens? You start to have swelling, fluid retention, which not only leads to swelling of your ankles and your legs, but the excess fluid in your blood in your body causes you to have high blood pressure. It could also start to build up in your lungs, so you start having shortness of breath. It's one of the minerals the kidneys love to filter is potassium. And if the potassium rises, suddenly your heart sometimes can't handle that. Do you know the waste products inside the blood, as it passes through your bone marrow and all that stuff, you start having problems with your red blood, becoming anemic. For that matter, your kidneys, as I said, produces a very important substance called erythropoietin, erythropoietin, erythropoietin. Somebody look that up. And that helps to stimulate red blood cell production. If your kidneys are failing and your erythropoietin starts to drop, boy, your red blood cells start to drop too. You know, kidney failure causing waste to build up in your blood will also end up with weak bones. It will also affect your sex drive. It will affect a whole set of other things. So I'm just pointing out these things. Your nerves start becoming affected. Your immune system will be affected. Your heart become affected. Don't be pregnant and have complications of kidney disease. That ain't right. And you start having a lot of these problems. So these things are very important. So chronic kidney disease is also, it involves a loss of kidney function, the ability to filter the waste products. That's a core aspect. So as I was telling you, in the early stages of chronic kidney disease, you might just have a few of these symptoms, not much, but the important thing is that you pick it up, or doctor pick it up, you don't ignore it. If you pick it up in time and you have a stitching time, says 9, there are things that can be done to help stop the progression of the kidney failure. It's people who just don't care about themselves, who sometimes have the progression of the kidney failure from being mild to moderate, going on to being severe. This is so sad, you know, it's really sad. And, you know, it's something that you need to have confidence in your doctor. We have 2 kidney specialists now in St. Vincent, and it's good that we have this so that they could streamline the treatment for you. Chronic kidney disease, as I said, can affect so many different parts of your body. I've pointed out to a lot of those symptoms. But I want to touch on another subject. There are some medication that can destroy the kidneys. There are 10 common habits that may harm your kidneys. I want to go through them. If you are taking excess, if you're taking overdose of painkillers are notorious to damage the kidneys. If you are taking in excess salt in your food, if you're a person who's a salt shaker, you're shaking salt into your food all the time, you love salty foods, mark my word, you're going to be in problem. If you're eating a whole set of processed food, no doubt your pressure is going to start going up. If you're not drinking enough water, you hear that? I'm not talking about some of the other things I was telling you, you're taking too much painkillers, taking too much salt, taking too much processed food. But this one, if you're not drinking enough clear, beautiful Vincentian water, right? Sometimes what may affect your kidneys in a mild way is lack of sleep, or eating certain type of like too much sugar, too much meat, and all these things are important markers that we should. Now, what is the best drink for your kidneys? Come out. If I were to ask you that question, what is the best drink for your kidneys?
Kidney. Water.
Was that too easy? Water has no calorie, has no sugar, has no additives. It is without a doubt the best choice of kidney health. Kidneys use water to filter waste materials and keep your body working correctly. Now, I know it may sound funny. I said to you, if your kidneys are failing, then your bodies will start to hold on to the water and not be able to filter water, not be able to get rid of the water. You start to swell. So if I ask you what is the best drink for your kidneys, I'm talking about for normal kidneys. The best drink for normal kidney is water. Not any red stuff, not any blue stuff, not any stuff with this, that, the other, alcohol in it. Let me ask another question. What drinks are hardest on your kidneys? Kamal, can I ask you, do you know what drinks are hardest on your kidneys?
Strong rum. Strong rum.
Well,
Alcohol.
I want to tell you that you're right. They're the hardest, but there are some other drinks that may actually be even worse. Soda is one of the worst drink for kidney health. Regular soda is packed with sugar and caffeine. Dark sodas, you know what I mean by dark sodas? They mean Coca-Cola and all of the colas, Dr. Pepper, all of that, also contain phosphorus additives. And these can be harmful to people with kidney problems because they can cause bone and heart damage as well. So
All right, we have a caller.
okay, all right, yeah.
Caller, go ahead. Okay, we missed a caller.
Oh, I hope they could call back there. So, Kamal, you're right. Alcohol is bad. But sodas is just as bad. That's the point I'm making. Now, I said water is good. Can you tell me, Kamal, if there's other drink that may be good too? I mean, you hear me talk about it all the time. Let me put you on the spot. Coconut water.
Oh yeah.
is good for the kidneys.
Yes.
Coconut water contains natural potassium and magnesium. Coconut water is good for your daughter. Yes, coconut water contains natural potassium and magnesium that help restore lost nutrient levels, put back in the electrolytes in your body, thus supporting the proper functioning of the kidneys. The consumption of coconut water after surgery, let's say, can help eliminate any remaining, let's say, kidney stones or prevent the formation of new kind of problem. Now, let me ask you, they ask which
All right.
fruit.
Before you go on, we have the caller back.
Okay, right. Yes. Hello, good evening. Can I hear you? Are they on?
They're supposed to be on, but for some reason I'm not getting any audio.
Oh dear.
Doc,
Okay, here they are.
Yes. Yes, go right ahead.
I want to ask you, why is it so expensive? What is it you're paying for when you have to go on dialysis? Why it is so costly? Because some people have preferred, some people have chosen to die because they just couldn't. I had a friend who did that. I know someone who chose to die to leave whatever savings he had to educate his children. We actually spoke a couple of days before he died.
Now,
I find it why this is so expensive. The treatment of dialysis. What is it we paid for?
can I clarify? Was this 10 or 15 years ago a person died?
In what?
Was it about 10 or 15 years ago that person died?
Yeah.
Yes, as opposed to a year ago.
About that or more than that?
No. But let me explain something to you. I remember I had a very good friend named Decent Henry. He's a Vincentian.
Yeah, I remember him.
Yes, and he went off to England and he had several attempts at kidney transplant and they failed.
Yes.
And he used to have dialysis. But I was there when he was having dialysis when I was in medical school. And believe it or not, around the world, dialysis was a very expensive commodity. Here's the reason why. If you are taking blood out and cleaning that blood and putting it back in, you don't want to put back in germs, bacteria. You don't want to put back in dirt. You don't want to put back in the wrong things back into the person's body because they will die quickly. So the machines that we had 10, 15, 20, 30 years ago were very difficult to operate. You needed a nurse. You needed all sorts of filters that had to be changed every single time. You needed to clean the equipment in special ways so that blood is not, and especially if this kidney machine is being used to treat many different people, I can't take a kidney machine and treat you, Dave, and then the next day I'm treating somebody else and it hasn't been properly cleaned. But the method of cleaning required so many procedures to clean it. It was very expensive. Consider nurses. But guess what? They have been able to develop some new kidney machines, smaller, that people can have in their homes, that somebody could be trained to operate themselves, and that the cost of treating kidney failure and dialysis came down significantly, right? So 10, 15 years ago, dialysis was so expensive that it would break the bank. Whereas today, there are a lot of people in St. Vincent who are getting dialysis free of cost. You go out to
Well, that's
Georgetown.
good. That's good. I hear you explain all of that. I saw Decent Henry came home, and I went to Georgetown Hospital because I I was invited to feature, take pictures. Those pictures were out at the Singer Show window that I
Yes.
took of him. Some real lovely shots of him treating himself with the machine. And
Yes.
but from I still, with all the advancement that we have now in medicine, I would want to believe. Yes, I am happy to hear.
So let me just stop you
But
there.
I'm careful of that. That is something I wouldn't want to, see decent
Yes.
Henry in that
Yes.
situation. I mean, but he was quite happy with himself. You have to
Well,
have
you
a
see,
strong heart. You have to
yes,
have good resilience and all of that. I'm saying that because not everybody could do what I saw decent Henry did at Georgetown
right, right.
Hospital at the time.
So let me explain. Descent in England, he got trained, and because it was life and death, he took it to the training, and he learned it because his life depended on it.
Okay, I can understand all of that.
He was able to get the machines and bring them down with him so that he could now come down on a holiday and treat himself. Now, when he was here, he was able to help out a few other people. But guess what? The equipment and all those other things was still very expensive, even though he brought on some things. Now, today,
Yeah.
we have two kidney specialists, Dr. Brown Caesar. This is Saboto Caesar's wife. Is
Yeah, I know what you mean.
is a super consultant. There's another nephrologist as well. We have two of them. Before we had nobody at all, and we have had nurses now trained. So there is kidney disease that could be treated in Kingston, treated at Milton Cato, treated in Georgetown, and we have a
All over, it
huge
should
unit.
be all over the country. But sometimes when you guys speak like that, you don't expect anything better to come. You,
Well,
you, 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 did
let me
you
tell you,
want to remain at the same stage?
let me tell you something. As a medical doctor, I could tell you that last year there may have been a cancer that nobody could treat. And next year, they could come up with a treatment that now can treat that cancer or can treat it. The ability to treat a disease. Even though we watch television, we see things being done by Dr. Hauser and all this. There are some illnesses that are so complex and difficult to treat that, unfortunately, but I am happy that today chronic renal failure, kidney disease, and dialysis can be treated with dialysis and even a transplant. But, Dave, I still say the best treatment is that a stitch in time saves nine. Prevention is better than cure. And preventing sugar kidney failure and pressure kidney failure is the important way to go. You can prevent this, and by preventing it, less people will graduate to the stage of needing dialysis or a kidney transplant. I am saying
Yeah, well,
right in front of you at the new hospital that's going to be built. That may be
come on,
finished.
man. Well, yeah, but I am not sure I am going to live to see that. So I hear
Yes,
you, and I
but,
could
but,
understand.
but I'm talking about
Why you
to
start
all the
advertising?
listeners. But I'm talking to
Huh?
all the
Come on,
listeners. I'm
come
not just
on.
talking. I'm not talking just to you alone. I want you to say, Dave, I am not talking to you alone. I'm talking to that person who now only has mild kidney disease or moderate kidney disease.
Mhm.
within the
I
next
hear you
year.
talk about coconut water. I love my coconut. And I drink. I try to drink a lot of water.
Yeah. But listen,
But
within the next year, Dave, within the next year,
even the medical personnel could save you.
no, listen,
Are you into that?
within the next year,
Huh?
we are going to be
What?
able to, within the next year, in 2026, kidney transplantation will be done at the new acute care referral hospital at Annesville below you.
Oh God,
Right?
I am happy to hear that. I am happy to hear that. And
Yeah.
we still behind time, isn't that so? We still
listen,
behind time. But
listen,
I'm not
listen,
talking to a politician and at the same time a doctor.
Put it this way, behind
pensioner.
time.
What do you call
Behind-
it? What's your
behind
specialty?
Let me tell you, behind time, I have been to many parts of the world, even in the United States, where there's no doctors. You go to an Indian reservation, you go into the Midwest and the South, some small towns. You think they have a kidney specialist there? You think they have dialysis and so? No, you have to go to the big city. I've been to Kenya and Nigeria. I've been to Egypt. Many parts, those are big countries. They don't have dialysis all over the place in every single village. Dave,
Well, I
the best
only
thing.
suggest
No, listen,
that
the best
we
thing
forget,
is to. The best
because
thing is
sometimes we spend money on ridiculous things that we shouldn't spend money on. So don't forget that too. Sometimes we
point
waste
about it-
money on other things that are not important in terms of health and all of that.
let me give an
Right?
example.
Anyhow,
Let me give an answer.
I just want us to test you.
A cell phone used to cost thousands of dollars. Now you get a cell phone for $100, $200. The price often comes down. So I'm saying the making of machines such as dialysis machines, the important thing is that don't let the dialysis machine cause trouble by causing infection of the patient, by causing
I hear that.
you don't want HIV disease to go from one patient, a HIV patient who has kidney failure, must get dialysis. But you don't want the machine to go and infect somebody else because the machine ain't get cleaned properly, Dave. You know what I mean? And you're quick to use it again. So I'm saying there are procedures, and that's just one example. That's one example. I'm making the point that I am
Talking about HIV, do we have that under control here in the country right now?
Gentlemen, not to disrupt you, but Dr. Thompson, we have just about 2 more minutes in the program remaining.
Dave, I want you to come off and let me answer that question.
It's good information.
I want you to come off and let me answer that question. So Dave, thank you very much for calling, so I can wrap up. All right. Thank you very much. My pleasure. Now, everybody, I want to tell you, the United States used to provide a tremendous amount of money for HIV care in many different parts of the world. That funding has now virtually been stopped. USAID and all this other stuff, it is stopped. And I just answer the question in that way. But the premise of today is kidney failure is real. Kidney failure, the big cause is diabetes and hypertension. Control your diabetes and your hypertension. The other reasons but don't drink a whole set of sodas. Don't drink a whole set of alcohol. Make sure a stitch in time saves 9. Ladies and gentlemen, it's been a wonderful evening. I'm in Dominica. I'm having a good time here. But it's always a pleasure being on radio with you. Do have a pleasant good evening and good night.
Thank you very much, Dr. Gerald Thompson. You do continue to enjoy yourself.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m.